So we're looking at, coming back from the holidays, starting 2021 with record-breaking new COVID cases daily. Um, an average of 2,000 a day that we've been seeing. What is that like for you when you're hearing this? Are you alarmed at this news?
Uh, sure. I mean, certainly. Clearly, the situation has not gotten better. We are worse off now in terms of the number of daily cases than we were at the beginning of December. Um, the problem is, it's hard to say what that means. A lot of people say, it's like, well, does that mean the lockdown's not working? And you can't really draw that conclusion because you don't know how bad things could have been if we hadn't done the lockdown. So we never know what the counterfactual example would have been. Clearly, though, we have to look at the situation and realize the number of cases is going up. If we were to end the lockdown as planned, the situation could get worse. And we still haven't really fully seen the full impact of the holiday season. If people did break isolation rules and got together and celebrated, we're only going to see the effects of that in maybe another week or two. So clearly things are going to get worse before they get better. The vaccine will ultimately help with this situation, but it's going to take a while before everybody can get vaccinated. And it's going to be a hard few months ahead, especially if people continue to go out and gather in groups because the virus will keep spreading.
What exactly is your take on how the government should be reacting to this presently on the current situation?
If we want to get the numbers under control and keep things as stable as possible and try to prevent us from hitting a 3,000 cases per day milestone, we're probably going to have to extend the lockdown at least for a little bit. I mean, the longer we can get people to stay home, the more we drive down the case numbers. So I understand that there's an economic impact to continuing a lockdown, but remember that there's an economic impact to having a bunch of people sick and in hospital and in the ICU. That's not free either. So we might need to extend things for a little bit. And I think we have to realize that we're going to have to make still some sacrifices, at least for a little bit, because this virus is not going to go away anytime soon.
Holding the lockdown the way that we did back in the spring when it was so new to us, what do you think about that? Do you think the lockdown not only should be extended, give me your time frame, but also stricter?
Well, it would certainly help. The longer we can make the lockdown, the stricter we can make a lockdown, the less we can have person to person physical interactions, the less cases we're going to have. That's just a given. You're always going to have to counterbalance that against, the economic impact and the difficulty of enforcing the lockdown. There's a lot of practical implications to all of this. But from the purely medical standpoint, if the goal is to reduce the number of infections and to drive down the case numbers, the longer and more extensive a lockdown is, the more effective it's going to be.
So it's pretty much unrealistic in the sense right now to believe that come January 11th, past that point, things will open up again. You don't see that happening?
Well, it's hard to say what's going to happen, and it's hard to see what the government's rationale is. I think if you look at the case numbers at the beginning of the lockdown and now at the end of the lockdown, they are higher. So it's going to be hard to justify ending a lockdown when the situation is worse than it was at the beginning. It might be that if we continue along this path, we can stabilize and bring the numbers down a bit. But we don't know. We only see the trends in retrospect. So for now, because we are expecting a bump in cases in January, the safest option, again, from the public health standpoint, is to try to extend the lockdown at least for a little bit, get the situation under control, and then reassess the situation maybe towards the end of January.
When will we truly have a picture of, what the Christmas and New Year's holidays did for this and how the measures worked or didn't work?
It'll probably take about 2 weeks. Remember, there's a bit of a lag between what you do and when you end up testing positive, because you get infected or you get exposed on day one. It may take you 3 or 4 days to develop symptoms. You then may sort of live with the symptoms for 1 or 2 days, at which point you decide to get a test. It then takes you maybe 2 or 3 days to get an appointment, and then another 4 or 5 days to get your test results back. So from the time that your test result comes back positive, your exposure may have happened between 1 or 2 weeks ago. So you usually want to have about a 2-week lag or you usually see a 2 week lag between when you were exposed and when the numbers come back positive. So we're going to have to wait a couple of weeks, at least until mid-January, before we see the full effect of what happens over the holiday period.
So is it recommended in that sense to, keep things as they are now, kids, going to school virtually, not in person, us just going out to do our most essential shopping? What do you think about that? Do you think that will help, just the fact that we won't be shopping as much and that the kids aren't actually, in schools with, 20 to 25 or even more per class?
Every little bit helps. The less we have people going out and interacting with each other, the less viral spread that we're going to have. There are practical problems and limitations to all of this. Online learning is easier for older children, harder for younger children. So much more feasible when you talk about universities and college and older high school students. It becomes more difficult when you talk about younger high school students and elementary school students. It's still possible, but it's harder. And so we're going to have to weigh the risks and the benefits. And if we decide as a society that school is important, which of course it obviously is, and if we decide that we just can't do online learning, especially for younger elementary school students, which is an understandable challenge, then we're going to have to make sacrifices in other areas to allow the schools to stay open, because the more we have people interacting with each other, the more viral spread that we're going to have. And so the more we can limit it in other areas, the better off we're going to be.
And just to sort of wrap it up, the idea of, non-essential shopping at this time, is it not possible? What are you thinking for the next, month or so?
I would say that if you have the capacity to do so, better to order your stuff online or curbside pickup if that's an option, because the more we have people going into stores, the more you're going to interact with someone, the worse off we're going to be. We have to cut down on as much unnecessary activity as possible. And, with the advantage of the internet, with the advantage of online shopping, much better if we can do stuff remotely and avoid this type of in-person interaction, because that is how the virus spreads and that is how the case numbers continue to rise.
Okay. Anything else you want to add, Dr. Labos, that I didn't touch on? Anything else you want Quebecers to know at this time?
No, I think that's the long and the short of it. It's sort of the same information, but it's the fundamentals. And as long as we keep repeating that over and over again, I think that's the key aspect.